The process of change. In the physical therapy profession, there is always going to be issues that need to be heard, addressed, and solved. Here is the process of how that goes about. One current practice issue example: as autonomous professionals, PTs are responsible and accountable for the legal aspect of care delivery. To best meet clients' needs, PTs can allow supportive personnel during the delivery of care. Only a PT, PTA, and PT aide are participants in delivering the service. A PT has his own practice. His practice recently has grown in size and the intake of patients has increased. The PT has 2 employees, one who is a PTA and the other who is an athletic trainer. The PT wants the athletic trainer to treat a patient who has a torn ACL. The athletic trainer is unable to fulfill the PT's request. Do you know why? Even though the athletic trainer has professional knowledge and experience treating this condition, he is still an athletic trainer, not a PTA or a PT aide. Legally, the PT can only delegate the task to the PTA. To maintain the PT's profit, he would only like to have one employee that is legally permitted to treat all of his patients. Because of legality, the PT is forced to employ both of the athletic trainer and the PTA. As an APTA member, the PT wants to bring up the issue for change. How do we go about doing that? We have an APTA structure. The House of Delegates is our authority and decision maker, which consists of a committee and officers. The committee consists of chapter delegates of the states who are voting voices and the section delegates who are non-voting. We have a board of directors, 6 officers, and 9 directors. There are 51 chapter members, 18 section members, and a student assembly and a PTA caucus. We also have related organizations, a foundation for post-professional PTs, a World Confederation of PT, CAPTA, which is an accredited PTA program, PTPAC, a political action committee and fundraising, and the Federation of State Boards with writing licensure exam. How this practice issue would be solved. The PT would first have to reach out to the chapter or the state who is their voting voice. The chapter then takes the issue to the House of Delegates. The House of Delegates passes it to the committee, where then the committee members, healthcare professionals, and personnel investigate this issue and report back to the House of Delegates. The House of Delegates then considers all of the research provided to provide a final outcome on the issue. As of now, the current issue is not resolved. If the end result is that the PT can delegate tasks to other healthcare professionals, like the athletic trainer, there will be less job openings for PTAs due to the PTs only hiring an athletic trainer instead of having to hire both an athletic trainer and PTA. Because of a possible decline of PTA job opportunities, PTA education programs may suffer. In conclusion, as PTA professionals, we look to our chapters as our voting voice. They take our concerns to the House of Delegates in hopes of having our concerns heard. Because we may not always agree on the issues, it is necessary to have a system set in place to deliberate issues and have a higher authority ultimately make the final decision. Questions, thoughts, comments?